Good morning. Good morning. RD Saya from WHO Wipro. Excellencies, participants, good morning. I'm Hussein Rashid, Regional Advisor, Water Sanitation, Climate Change from WHO Southeast Asia Regional Office, and I'll be moderating this session. As we all know that the climate crisis is a health crisis with widespread and growing impacts of health systems and health determinants, determining sectors. Given the health impacts of climate change and many health core benefits of climate mitigation and adaptation across sectors, and the need for climate resilience, low carbon health systems, health is now recognized as a priority in nationally determined contributions, NDCs. This event, therefore, will explore the opportunities for countries to integrate health in the planning and delivery of their NDCs, building on the new WHO technical guidance on quality criteria for integrating health into NDCs and the Climate Promise Initiative led by UNDP. Participants will be able to understand and empower to consider the health considerations across key components of NDCs, showcasing practical approaches and inspirational experiences from multiple countries. To begin with, let us first invite our RD from Wipro, Dr. Saya, to deliver the opening remarks. Over to you, RD.
Distinguished panel members, representatives, ladies and gentlemen, good morning, and it's a pleasure to be here this morning. And I know we are all here for the same purpose. We are alarmed by the intensity, the frequency, and the destructiveness of extreme weather events, and how these impacts on the lives of so many people every day. We are alarmed at the changing patterns of disease linked to climate change. Climate change is not just an environmental issue, it is a health crisis. Rising temperatures, extreme weather events, and shifting disease patterns pose significant threats to public health. The World Health Organization estimates that climate change will cause approximately 250,000 additional deaths per year between 2030 and 2050 due to malnutrition, malaria, diarrhea, and heat stress alone. These statistics underscore the urgency of integrating health consideration into our climate policies. The time for diagnosis of our problem is over. Now, we must ask ourselves a very critical question. Are our health systems resilient enough to withstand the increased effect of climate change? And if we look honestly in the mirror, the answer is clear. They are not. As a surgeon, one of the most critical decisions to make whether to operate or not to. In this case, it is time to operate to heal our planet. As we navigate the complexities of climate change, we must recognize that environmental sustainability and public health are inseparable. They are two sides of the same coin, each essential to our collective future. With health increasingly impacted by climate change, the many health co-benefits of climate mitigation and adaptation across sectors, the need for climate resilient, low carbon health systems, it is heartening that health is now recognized as a priority in nationally determined contribution, or NDCs. NDCs are one of the key national climate plans in the Paris Agreement, agreed by 195 countries and territories. Healthy NDCs are national climate commitments that protect climate system and advance human health and well-being for present and future generations. Our collective efforts must transcend traditional sectoral boundaries. We must foster a holistic approach that integrates health and climate policies, addressing these challenges in unison for the well-being of people and the planet alike. NDCs are pivotal in our global response to climate change. They represent each country's commitment to playing a part in reducing greenhouse gas emissions and adapting to climate impacts. By embedding health into NDCs, we can ensure that our climate action also promote health equity, reduce healthcare costs, and enhance the resilience of our communities. In the Western Pacific, WHO has set out our new vision of weaving health for families, communities, and societies. And we use the weaving metaphor as a symbol to visualize the importance of our collective action to promote, provide, and protect each other's health. Our health system must be resilient in order to meet our health needs during the climate crisis. And yet, many of our health systems are already broken. About a fourth of all healthcare facilities do not have running water. Many do not have proper waste disposal. Energy is not sustainable, and many are too closely located to coastal areas. So collaboration between health and other sectors is essential in addressing these challenges. For instance, reducing air pollution not only mitigates climate change, but also decreases respiratory and cardiovascular diseases. Water is also a necessary piece of the climate solution. Without considering fresh water and associated ecosystems in adaptation and mitigation, the Paris Agreement will likely to be out of reach. Through prioritizing adaptive water planning and management, countries can build climate-resilient health systems and societies that benefit both and the planet. Sustainable agricultural practices can improve food security and nutrition, reducing the burden of diet-related diseases and chemical exposure and ingestion. Designing cities with green spaces and active transportation options promotes physical activity and mental well-being. The private sector can play a crucial role by adopting sustainable practices that protect both environment and public health. Win-win options, as they are sometimes called. Civil society organizations are vital in raising awareness and advocating for policies that prioritize health in climate action. But these actions all need a strong evidence base, which is supported by research institutions developing evidence to inform policy decisions and track progress. The systems we build must have a low impact on the environment and be designed to withstand extreme weather events. Health systems must be made more resilient to all hazards, including climate risks, and more sustainable to reduce greenhouse gas emissions. I acknowledge the challenges that limit this integration, such as limited resources and competing priorities. But by leveraging international funding mechanisms, such as the Green Climate Fund, the necessary financial support can be obtained. Climate financing is a smart investment. It leads to economic growth, increased jobs, diversified industries, resilient communities, and lower healthcare costs. Current levels of international climate financing, including for sea level rise, are insufficient. Health-specific climate action remains underfunded. It is time to change the narrative. Imagine a world where every healthcare facility, no matter how remote, is ready for floods, heat waves, and power outages. Imagine a world where a hospital can be a point of refuge with clean water, sanitation, waste disposal, and energy to supply food and water to the displaced. Imagine healthcare workers with quick access to boat, amphibious vehicles, or bicycles to be able to reach disaster hit area. This is a world where our healthcare system is not a victim of climate change, but a frontline defender against it. Ladies and gentlemen, it is time to operate. The window for action is closing, and without immediate intervention, the cost to human health and communities will continue to rise. Let us build on our strength, and let us face this challenge with resolve. Let us put health protection at the center of our climate investment. Health is the argument for climate action, and I thank you.
Thank you very much, R.D. Saya, for setting the tone and the context for our discussions in this session. And of course, realizing NDCs, Paris Agreement, and the commitments of COP and all these negotiations, the health sector collaboration and our health argument, as you rightly mentioned, is central to the negotiations and the investments. That's the key, because that's the main thing if we are to realize SDGs and overall health goals. And health facility readiness is what can really measure how best we are prepared to address the challenges we face in terms of climate crisis. With this, now may I invite our next speaker, Fernando Jimenez, the Director Sectoral Cooperation from Spanish agency.
Good morning, distinguished colleagues and health and climate change prevention activists. I think it's frankly not only the technical level of the audience, but actually the excellent introduction of Dr. Saya Mau Piokala. I think it's very hard to add something or to stress something you don't know already, but let me try, however, since you invited me. It's an honor really to address you today as Director of Multilateral and Financial Cooperation of the Spanish Cooperation Agency. Everything that I know that you already shared, that we are at a critical moment in history where climate change is no longer a distant threat, as we painfully learned 2 weeks ago in Valencia in Spain, where all the flooding destroyed lives, futures, and infrastructure. So that's why the support, international support to health and the interaction between health and climate change is one of the top priorities of our agency, that actually allocates 22% of its annual budget to health-related issues. And we are very close and very honored contributors of WHO, of NDC partnerships, and also the Pan American Health Organization. Not only, I mean, as you know, the interaction between health and climate change goes both ways, as you very clearly signaled. We talk a lot, and it's clear that we know the devastating consequences of climate change, not only on the planet and the environment, but also on human health And also the fact that is critical for our agency that the most vulnerable population are the ones who suffer more differentially. You know? So, but also resilient health systems are important because also, let's face it, the health sector also contributes negatively in many instances through transportation costs, treatment of processes, etc. No? So that's where NDC partnerships really comes in. No? The NDC partnership, which Spain is a proud member of, is a powerful example, as the doctor was saying, of global collaboration. And that can turn the promise of climate action into real effective solution. As you also pointed out, it's time for action because, as I said, it's not a distant threat. No, and I think it's a very strategic movement or initiative really to integrate these health considerations in the NDCs, and this is the right moment to do this. But of course, all these matters are intertwined: food security, gender, health, financial inclusion, environment. NDC partnerships helps really to integrate health into the NDCs by, as you know, by providing technical assistance, capacity building, and funding to ensure that there are public health outcomes. We are very concerned about the universal access to health. I think many countries with COVID, everybody talks about the deaths caused by the pandemic, but not about the premature deaths caused because all the many resources were allocated exclusively for that. So we have now developed an international health strategy that aims at securing health systems, resilient health system, and guarantee global universal access to health. So, what can I say? By aligning climate and health goals, we can create a future where the transition to a sustainable world means healthier communities as well. And Spain has been always a strong advocate for this climate health integration. One area that also was mentioned by Dr. Saya is the health infrastructure. There's a direct threat to health systems, and by aligning NDCs with investment in this climate resilient health infrastructure, we can mobilize the resources to implement climate and health solution. But and then everybody knows that perhaps the most important SDGs after the one on health is the one on partnerships. Not this, we need to work together. Private sector, governments, international organization, civil society, and this is one of the NDCs, let's face it, is one of the most powerful tools to do so, to achieve this goal. So let's make sure that the future we build is one where a healthy planet means also healthy people, and where our response to climate crisis protects lives across the globe. So thank you very much, and congratulations for this panel.
Thank you very much, Fernando Jimenez, for your insightful remarks. We acknowledge your support and partnership for climate action as a partner, and it's really essential in terms of the impactful actions that needs to be done at country level, which is benefiting the countries. And of course, we will hear more from the country actions as we discuss, and you will realize the various activities and actions that is taking place at country level to address the issue. Now, may I invite next Dr. Rachel to come on. Yeah, but first I'm inviting the panelists to come and sit here. Yeah. I'll invite, yeah. So I'll invite Rachel, is the head of mitigation, climate and health from Wellcome Trust, and Elena from WHO, Elena Villalobos. And also, may I invite Honorable Vice Minister from Laos to the panel. And from Tunisia, we have Amna Helmi also to the panel. So thank you very much, all the panelists. Now, let me invite Rachel from Wellcome Trust to give the remarks. Thank you.
Thank you very much. It's an absolute pleasure to be here this morning with such distinguished guests, and I'm really looking forward to the panel discussions and hearing from the country experiences. Wellcome is thrilled to be co-hosting this with the World Health Organization. We absolutely recognize, applaud, and appreciate the leadership that the WHO has shown on climate and health, and our continued collaboration with the WHO. I'd also like to thank the NDC partnership for hosting us in this fabulous, cozy pavilion here. And I'd like to thank all of you for coming to join such an important, timely, and relevant discussion. So I'm going to, in my brief presentation, just do some scene setting around the science and the health impacts that really clearly demonstrate why including health in NDCs is so critical. I'm also going to touch on the potential benefits of doing so as well. So we've already heard that the climate crisis is a health crisis. And that really is why we need to think about health in NDCs. Wellcome support the Lancet Countdown to track the impacts of climate change on health. And in their latest report released earlier this month, they show that 10 of 15 indicators that monitor climate change impacts on health are at record high levels. Here you can see on the screen an indicator showing the impact of extreme heat. So in 2023, heat-related mortality in over 65s was at the highest level recorded, 167% higher than in the 1990s, and over twice as high as if we hadn't had temperature change. So as well as tracking extreme heat, Lancet Countdown covers the impact of extreme precipitation, drought, food insecurity, and infectious diseases on health. I don't have time to cover all of those today, but I wanted to give you one more example. And as you can see here, this is around infectious diseases. And this graph shows the increase in the transmission risk of dengue. And this is fueling the growing dengue incidence of dengue globally. So the science is clear. We absolutely need to act. The good news is that there's huge potential benefits from acting. And if we implement ambitious climate mitigation measures, we can realize those benefits. So this graphic here is from the Lancet Pathfinder Commission. Pathfinder undertook an umbrella review looking at all of the evidence relating to mitigation and health impacts. And this graphic shows the wide range of health co-benefits that can result across a whole number of mitigation measures. Again, I won't go through it in detail, but I'd encourage you to go and look at both the Countdown report website and the Pathfinder reports. The report identified 3 main pathways between mitigation and health. And the first of those is around reducing air pollution through switching from polluting fossil fuels to clean and renewable energies. The second is around sustainable and healthy diets that help to reduce emissions from agriculture, livestock, and deforestation. And the third main pathway is around increasing active mobility and public transport, helping to reduce physical inactivity, which is one of the main causes of non-communicable disease. And you can see on the left of the graphic the list of mitigation actions that then lead to these three main pathways around air pollution, diet, and physical activity. And moving on, you can see the range of health impacts that those pathways result in. And finally, on the right, we can see the mortality and morbidity gains from taking these actions. And that finish point, if you like, shows that not only will acting on climate help reduce premature deaths, but it will increase overall quality of life. So Pathfinder harmonized the climate and health benefits across all of those actions for which they had sufficient evidence. And here you can see on the left-hand side the greenhouse gas reductions, and on the right-hand side the health benefits. And I don't intend you, and the graph's too small for you to understand the detail, but you can just get a sense that there's both greenhouse gas benefits and health benefits to be had across a range of actions. Some of them have greater greenhouse gas impacts, some of them have greater health impacts, but there's a win-win to be had there, and that's really what I wanted to emphasize with this graphic. And as I said, the potential is huge. So the modeled results from just 9 nationally determined contributions showed that compared with current pathway scenarios, more sustainable scenarios have the potential to reduce premature mortality by around 1.18 million in terms of air pollution related premature deaths by 2040, and reduce by 5.86 million in relation to more sustainable and healthy diets. And finally, to reduce by 1.15 million the number of deaths associated with physical activity through increasing that active mobility in public transit, as I said. And the even better news is that not only are there huge potential gains, but we're also realizing those already through acting. So again, going back to the countdown report from earlier this month, one of the indicators tracks deaths from outdoor air pollution. And this shows that between 2016 and 2021, deaths from outdoor air pollution reduced by nearly 7%. So when we do take action, we can have an absolutely massive impact, and we can do so relatively quickly. We're not doing enough yet, but we are rapidly improving. So again, Countdown tracks a number of ways that we're addressing efforts, and efforts to include health in climate change assessments and planning are increasing. So the number of countries having developed climate change and health vulnerability and adaptation assessments grew from just 11 in 2022 to 50 the following year. And those having completed their health national adaptation plans increased from 4 to 43. So we are definitely getting our act together. So in summary, the 3 takeaways I want to leave you with are, number 1, the science is clear. We absolutely need to act. Climate change is impacting our health in a myriad of ways, so we need to consider the risks across extreme weather, food insecurity, and transmission of disease when we're considering NDCs. But not only can we prevent these health harms that we're experiencing at the moment, we can gain a huge number of health benefits by taking climate action. And the big potential areas for health co-benefits that we can bring into our NDCs are those 3 I mentioned around eliminating fossil fuels and improving air quality, around healthy and sustainable diets, and increased physical and low carbon transport. And finally, the third thing I wanted to leave you with is, as I showed on my last slide, we absolutely can do this. We can see the results when we decide to act, and including health in NDCs can be a win-win for both a healthier and a more sustainable future. Thank you.
Thank you very much. Certainly, there is opportunities, and thank you very much for bringing, and also thank you very much for the excellent partnerships that we have in terms of organizing this event, and also the WHO Pavilion for all the support that you have been providing, and all, I mean, the trust that we have and the partnership we have, and I think that's where we can make a difference. And of course, you very much highlighted the alarming signs that we have in front of us, and of course, highlighting the opportunities that is available in terms of from mitigation and adaptation and all that we are trying to address. So thank you very much. And of course, it is evident that, as you rightly highlighted, it's all sector collaboration. It's not only the health sector, but it's needed this support collaboration from agriculture, from transport, from the planning, from the industry, from the environment. It's everyone's business. It's not just only health sector. So it's very good to highlight that. And building on that, on the point of air pollution, I think let us take this, our commitment from here on to the next second air pollution conference, which is taking place next year in Colombia as well. So I think we can build on our commitment discussions from here to make an impactful change at the conference next year. With this, may I invite Elena from WHO headquarters to make a presentation.
Thank you very, very much. I'm very happy to provide a presentation. I think there are a few slides there ready for me to use. So basically, I think after these excellent presentations, basically setting the scene, motivating us to understand which are the impacts and which is the urgency to operate, and then after the evidence that Rachel also provided, what I'm going to present is a very, very practical recommendations on the work that WHO is promoting, not only for the health systems and the health community overall to promote and protect health, but to also advocate for the responsibility of other sectors to promote and to protect the health of their populations. Basically, this is a brief summary of the 3 areas of work that WHO is promoting. The first one is supporting countries to understand and address the wide range of impacts from climate change. The second one is working at health systems and healthcare facility levels for them to become resilient, but also reduce as much as possible their own contribution to the problem of climate change, of course, keeping the quality of care that our population deserves. And the third one that is relevant for these discussions today is really working with other sectors to promote those mitigation actions in their own sector that will be accompanied by the most health benefits. In this regard, we just launched the other day this guidance, this is the WHO review of health in NDCs. Basically, we are seeing a positive trend on the integration of health within NDCs. Basically, what you can see there is that 91% of all the climate plans include health as a priority, and only 9% didn't include that. When it comes to co-benefits with regards to mitigation, only 30% of those national climate plans include health. And this is a problem because in the majority of the cases, they just mention health with regards to mitigation, but they don't go further to understand which are the health gains of different mitigation policies. So for example, we heard before about active transport. They may identify that health is good if you promote active transport, but they don't consider and assess which are the different health consequences, for example, of building a new highway and promoting active transport in different ways. When it goes to adaptation, and this is, we are seeing that even when NDCs were created really for countries to inform and to set targets for mitigation specific priorities and sectors, we see that many countries are also integrating their adaptation priorities and targets within the NDCs. Unfortunately, when they do that, they don't really include the specificity of their adaptation options that they want to promote. So we see opportunities for further integration of all the adaptation planning process that is happening at national level with this NDC process. So now we come to this quality criteria for integrating health in nationally determined contributions. We have Amy here as the lead author of this guidance. And basically what we did is a very simple and pragmatic approach looking at the structure of these NDC documents. So in most of the cases, you have all these six chapters. One is related to leadership and enabling environment, national circumstances, priorities and policies, mitigation, adaptation, loss and damage, and finance. And what we did is to create specific recommendations for each of these chapters that countries can easily consider and integrate within each of those. So if we go to some examples, for example, when you describe your national circumstances, first that you have to do is to ensure that the Ministry of Health is the one leading this exercise. So we want to see ministries of health promoting health across all of the sectors, convening all the sectors, discussing with them, and ensuring that they take the responsibility they have to protect the health of their populations. Of course, we want to promote coherence between national climate change and health policy processes. So we want to really look into this integration across both sectors. We want to promote health planning is basically informed by climate, but also climate programming is informed by health goals. And probably the most important one is to ensure that health and well-being is the guiding principle for the design, is the ultimate goal of all the climate plans. Because again, it's not only to depict health as impacted by climate change, but we are really convinced that the health argument is the argument that is going to move to greater ambition in climate action at country level. I will just go into some examples for mitigation in terms of the quality criteria that we are promoting, and I think that this fits very well with the presentation Rachel did. So when we consider health co-benefits of climate mitigation, we want to ensure that these climate mitigation targets and policies that are presented in the NDCs identify the potential health co-benefit within that. We want to ensure that estimations and monitoring of the potential economic, health, and environmental gains are also integrated within these NDCs, and that we prioritize those mitigation options that are maximizing the health gains. So something that is good is that we are ready to operate, we have tools, and WHO has developed already many tools that can be used by countries to assess and promote the health co-benefits of climate change. So we have very important tools developed by our colleagues in the air quality team, the climate age, the AirQ+, the carbon age, and basically these are really useful tools ready to be used and promoted by countries to get to quantification of health gains. We have tools also for urban and transport, and we have also tools to estimate the health gains from promoting green spaces at urban level. Again, this is all ready for countries and partners and other sectors to use. We will be happy to provide more information. We have links to all of this. And this is just one example of an assessment that we did 2 years ago with Wellcome Trust support. Basically, we use the AirQ+ tool to assess the health co-benefits of promoting specific policies in Pakistan. And basically what you see there is that when we estimated that basically promoting energy policies, clean energy policies in Pakistan was linked to this saving of 65 annual deaths per year, basically reducing exposure to air pollution. This is the quality criteria for quality targets, basically include standalone economic-wide targets, also in relation to short-lived climate pollutants. It's not only about CO2, but again, there are quick gains that we can get basically promoting short-lived climate the phase out of. Also include their quality targets. WHO, I need to be faster, I move. So basically also there is a, also as presented by Fernando, the health sector is also contributing to the problem. So in this case, under mitigation, we also have the possibility to integrate the targets that the health sector has to reduce its own contribution to mitigation, to climate change. Just to finish with this Alliance for Transformative Action on Climate and Health, and the point raised by Fernando again on partnerships. I think this is the moment where everybody's coming together. From WHO, again, after being alone, advocating for climate change and health for over 30 years, we are really moved to see all this movement, all of these key partners coming together and raising the importance and the need to operate. So we are leading this Alliance for Transformative Action on Climate and Health. We already have 91 countries coming together, not only to build the climate resilience of health systems, not only to decrease their own emissions, but also advocating for the health community overall to work with other sectors to come together in the protection of the health of their populations. So we count on all of you to come together under the attach to support all these 91 countries with their own priorities, their own solutions already identified, so for them to move to further action. With this is all from my side. Thank you very much.
So, thank you very much, Elena, for presenting the key WHO support that we provide to member states on climate change and health, and also health in NDCs. Also providing the guide updates on the guidelines and the opportunities that are available on the quality criteria with very practical examples that countries can, of course, implement. And also glad to see you sharing a lot of various different tools that has been developed by WHO, which are available for our member states to basically not only promote but also implement to ensure that their health system is more resilient to climate change, and they're promoting low carbon health systems. Now, with this, let us hear more from the countries, and Excellency Vice Minister from Laos is also here with us. So, Excellency Vice Minister, adaptation to climate change features prominently in Lao PDR NDC. How has health been integrated into the adaptation component of Lao PDR, and what are some of the key priorities for health adaptation? Excellency, if you want to use the microphone or if you want to come here, please. Thank you.
Good morning. Respect moderator, Dr. Sia Majopio-Kara, the regional director, distinguished colleagues, WHO colleagues, dear climate change activists, ladies and gentlemen. Regarding the question raised by the moderator, I would like to answer some issue regarding my country experiences of integrating health into NDC. On behalf of Lao PDR, Ministry of Health, I am pleased to convey the warmest greeting to you all, and sincerely thank to all panelists, participants, organizers of this event. As same as many other countries in the regions, Lao PDR face climate change and related health consequences. Climate change is a key driver of the increasing extreme weather events, displacement, damage of water sanitation facilities in healthcare facilities, and growing number of water, vector-borne disease, health-related medical conditions. As mentioned so far, our moderator, climate crisis is a health crisis. Of course, climate change making us sick, making our health deteriorating. So we have to integrate our health into a nationally determined contribution. Protecting health from changing climate is a key priority of Laos government. The government of Laos gives priority to health adaptation action, which is a part of NDC. Health adaptation strategy and health national adaptation plan developed in line with the overall national adaptation plan with NDC and the national socio-economic development and health sector development plan. We have seen that climate change is impediment. It's critical for us to reach universal health coverage. So the government of Laos PDR has included climate change into the draft of the 10 health sector development plan and the 12 national socio-economic development plan. Ministry of Health is supporting the implementation of NDC objective for increasing resilience of health services, infrastructure, water supply system in health facility by developing health-specific strategy and adaptation plans. The Health National Adaptation Plan is comprehensive, including health workforce development, set up an early warning system using weather and clinical data, enhancing climate resilient watch and in healthcare facility, and ensuring the climate change is incorporated into existing public health programs and strategies. Building implementation capacity of the HNAP, Health National Adaptation Plan, is a key issue. The Minister of Health of Laos PDR has made substantial steps in strengthening climate change training programs, training capacity, tool guides to vulnerability and capacity assessment, and carbon emission calculation, and water sanitation standard and healthcare waste management regulation. However, this effort, we need enabling factor. What are these enabling factors? We consider are multi-sectoral collaboration, coordination, evidence, climate and health data integration, national and global commitment, partner support, and technical guidance are necessary. The health risk of climate change, we cannot be underestimated the issue. We will support the revision of climate change adaptation strategy, strengthen the implementation capacity, finalize ongoing carbon emission assessment, and inform mitigation action for the health sector. That's our future forward action. I thank you for your attention.
Thank you, Excellency, Vice Minister. In fact, last year I had the privilege and opportunity to visit Laos for our UNDP JEF project review meeting, in which I also had the privilege to visit one of your health facilities, which is doing excellent work in terms of promoting climate resilient and environmental sustainability. So congratulations on this, and also you mentioned about the developments that you have already progress in terms of early warning systems and health HNAP, as well as the climate resilient watch. So congratulations, and we look forward. We understand all these hard work is through, even though achievements are going on, it's a lot of through challenges, and I had the opportunity to witness. So thank you very much for sharing this with us here today. Now let us hear from Ms. Amna Helmi, the Senior Engineer, Deputy Director, NDC Health Focal Point from Ministry of Health, Tunisia, and she will be speaking in French, I believe. So if you need interpretation, we will provide interpreters for those who need. Thank you. Floor is yours.
I'm so happy to share Tunisian health NDC experiences. Donc, my speech will be in French. Okay. Sorry, it will be easy for me to speak in French.
No problem.
Okay. Donc, la Tunisie est considérée parmi les pays les plus vulnérables au changement climatique, surtout suite à l'augmentation des températures et les extrêmes climatiques, les inondations par exemple. L'augmentation de température excède parfois, dans quelques régions, le 1,5 degré. Donc, justement, donc, en Tunisie, on a fait deux études épidémiologiques pour évaluer l'impact des extrêmes de température sur la santé. Et donc, c'est depuis l'année 2009 et on a vu une association entre les décès et la hausse de température et surtout les baisses de température. Les baisses de température influent sur le décès en Tunisie, plus que la hausse de température. Donc, on est conscient de l'impact des changements climatiques sur la santé, surtout qu'on observe à travers nos systèmes de suivi, de contrôle sanitaire, parfois des excédences de ces indicateurs qui sont liés au changement climatique, malgré qu'ils ne sont pas prouvés scientifiquement, on l'observe. Par exemple, l'hépatite A, on a une hausse d'hépatite A en Tunisie. C'est dû à l'augmentation de température au niveau de l'eau. Donc, il y a les enfants qui jouent dans ces eaux stagnantes. Donc, on a une augmentation de la prévalence de l'hépatite A, par exemple. Donc, depuis l'année 2010, on a commencé à sensibiliser nos partenaires de l'impact des changements climatiques et on a fait la version 1 d'un plan d'adaptation d'une stratégie nationale de changement climatique et la santé. Donc c'est depuis l'année 2010 et le processus a commencé depuis l'année 2009. Donc c'était un exercice avec nos partenaires, le ministère de l'Environnement et tous les partenaires. Ils étaient sensibilisés, ils ont participé à la mise en place de ce plan de la stratégie nationale d'adaptation au changement climatique du secteur de la santé, malgré que le secteur de la santé n'a pas été pris en considération, juste le health, la santé uniquement. Donc c'était une lacune dans notre stratégie, la version 1 de notre stratégie. Donc, il y a aussi, donc en plus, on a fait une relation relationnelle entre les intervenants, tous les intervenants, que ce soit dans donc on a commencé avec les sentiers environnementaux, donc on travaillait ensemble, toujours on travaillait ensemble, et justement pour continuer avec les changements climatiques et l'impact sur la santé, qui a suscité une fructueuse collaboration et ont été associés dans tout le processus. On est partenaire dans tout le processus d'adaptation au secteur au changement climatique, que ce soit le secteur de la santé, l'environnement, l'eau 2050, la stratégie agricole, l'agriculture 2050, le genre, la stratégie de la femme. Donc on était membres, on était associés dans tout le processus à l'échelle internationale et on peut inclure l'aspect santé dans tous les secteurs, à part le secteur de la santé. Donc, l'inclusion de la considération de santé publique dans le CDN offre en plus l'occasion d'accroître l'ambition en tenant compte des avantages sociaux connexes de l'action climatique, de la création de systèmes de santé résilients au changement climatique et des actions d'adaptation prioritaires et sur le social qui comptent pour la population et pour l'État. Et nous sommes là. Donc, la première NDC en Tunisie, c'est date depuis 2015. Donc, la première NDC, on n'était pas bien associés dans l'élaboration de cette NDC-là. Donc, uniquement, ils ont mandaté un consultant qui a fouetté les résultats de quelques études et tout ça. Il a mis les priorités d'après son point de vue. Donc, on était associés dans la validation finale de l'NDC. On a contesté de ne pas être un partenaire parce que c'est le ministère de la Santé qui fait les priorités. Ce n'est pas aux consultants de le faire. Donc, ils ont pris en considération l'actualisation en 2020. Donc, on était associés dans tout le processus, non pas seulement de le processus de NDC santé, mais uniquement dans tous les NDC de tous les secteurs. Donc, on était membre, on a pu intégrer l'aspect santé dans tous les NDC. Donc, justement, donc c'était un atelier, donc on a organisé, c'était un consultant qui fait l'NDC global pour le ministère de l'Environnement. Donc on a pu faire des concertations au niveau du ministère de la Santé. On a invité tous les partenaires au niveau du ministère de la Santé dont le programme peut être impacté par le changement climatique. Donc, on a fait des entretiens avec le consultant pour expliquer nos priorités, quelles sont les difficultés, les observations sur le plan santé en lien avec les changements climatiques. On a pu dresser des priorités. Donc, le consultant, il a fait un draft préalable et après, on a fait un workshop au ministère organisé par le ministère de l'Environnement. Donc, un workshop encore pour bien définir nos priorités avec un team. On a mis en place un team santé. Donc, il a été associé dans tout le processus. Donc, et on a fait le NDC actualisé en 2021. Donc, le Health Resilience Goals for 2013, c'est maîtriser les risques sanitaires liés au changement climatique et intégrer leur gestion grâce à un système de santé plus résilient. Donc, on a des priorités, renforcer les capacités du secteur de la santé publique pour une meilleure intégration de la dimension climatique et des infrastructures de santé résilientes au changement climatique. Cet aspect il a été omis à l'NDC, la première NDC. Renforcer la surveillance des maladies sensibles au climat et développer la capacité de détection précoce et d'alerte précoce des phénomènes à potentiellement épidémiques. Renforcer le rôle de la santé dans le leadership et la collaboration et promouvoir la recherche appliquée et on travaille là-dedans actuellement. Donc, ce travail, la mise en place de ces indices, on a pour chaque activité, on a fait le porteur de l'activité, la description et les mesures, okay? Les indicateurs. Donc, pour la mise en œuvre aussi, on a intégré les activités dans le plan de développement 2023-2025 du ministère de la Santé. Donc, on a intégré aussi au niveau du projet de performance annuelle du ministère de la Santé 2025, en 2025. C'est un document annexé au budget qui doit afficher les engagements du ministère de la Santé envers le programme de santé et également envers le changement climatique. C'est un programme budgétisé au niveau de soins de santé de base, services de santé hospitaliers, recherche universitaire et services hospitaliers et leadership au soutien. Donc, à la fin, je peux dire que pour atteindre nos objectifs et être une partie de l'action globale nationale relative au changement climatique, notamment en matière d'indices, nous devons croire au réel impact des changements climatiques sur la santé et travailler davantage sur la sensibilisation de nos partenaires jusqu'à l'appropriation de nos problématiques afin de nous aider à trouver les solutions, surtout que l'impact sanitaire des changements climatiques peut se traduire, il est quantifiable par des indicateurs quantifiables et parfois choquants, et bien sûr sans la construction d'un bon relationnel. Et merci.
Merci. Thank you very much. As we are running out of time, thank you very much for sharing the experience from Tunisia. May I invite Maria to wrap up and close? Thank you. Just in 2 minutes.
Thank you so much. Even less than 2 minutes. I understand that we need to leave the room, and I understand that you have a very, very good discussion. The gentleman over there is telling me that we need to go. It's okay? Okay, fantastic. You see, it was a tactic for you to feel bad and then give me an extra minute. Thank you all. I understand that there has been an amazing discussion. Thank you so much, Wellcome Trust. Thank you very much, our regional director and all the colleagues from the region representing here. Of course, thank you very much to the Spanish Agency for International Collaboration and Development. I don't know if I am translating properly. I know the Spanish thing, but anyway, they have been amazing. And of course, thank you very much, the NDCs partners. Just one minute message. For many years, we have been coming to COPs with one message: put health at the heart of climate change negotiation. This might sound a little bit philosophical, but what we are doing here today on the NDCs is tangible. So we are translating what do we mean by putting health at the center of the negotiations by using the NDCs, the nationally determined contributions. You can see that we can have a real impact, something that we can measure. We can measure the benefits for health that can be obtained. We can measure the adaptation process, how is this, and we can measure as well how finances will be finally allocated to the health sector. This collective effort will certainly result on the fact that health is the argument for climate action. And I think we can demonstrate that. No excuses. We have plenty of tools. As you know, we have WHO's guidance and the criteria for making sure that we incorporate. So no excuses. Tools, guidance, everything. Now is the time for make sure that the action is there as well. Thank you all for participating, and great work. Thanks. Thank you. Less than 2 minutes. Thanks. Thank you.